Welcome to Chat with a Professional, a monthly oral health education series by Oral Health Africa Initiative. This series is designed to bridge the gap between oral health professionals and the public by having honest, practical conversations, relatable ones about oral health. For our pioneer episode, that's the January episode, we are focusing on a very important topic, which is on oral health mistakes people still make in 2026. I mean, in this big 2026, and how to maintain healthy teeth and oral hygiene on a low budget. Today's conversation is for anyone who wants to take better care of their teeth without feeling necessarily financially overwhelmed or strained. I'm pleased to be joined here today by our Executive Director, Dr. Blessing. Dr. Blessing Odukweton is the founder and executive director of Oral Health Africa Initiative, leading youth-driven efforts to advance oral health education, prevention, and innovation across Africa. She holds a Bachelor of Dental Surgery from the University of Ibadan and has over 7 years of experience in oral health advocacy, community outreach, public health-focused initiative. She's currently pursuing a master in public health at the University of Wolverhampton, strengthening her expertise in population health and health systems. Her work emphasizes early detection, preventive care, and sustainable partnership to reduce oral health disparities. Without further ado, I will be bringing up our guest for today. Dr. Blessing, you're welcome. Thank you so much for joining us in today's session.
Thank you, Temitayo. Thanks for the invite, too.
Before we go into what we have today, Dr. Blessing, can you tell us the common oral health mistakes you think people still make in 2026?
All right, thank you so much. That's a very brilliant question. I would set up on the list from my own research would be brushing once a day or not even brushing at all. This is one mistake that most people still make. I mean, everyone generally, professionals, non-professionals, because most people just brush based on their own convenience. But one thing I've realized with time is that plaque formation is something that happens like every time. Like once you're exposed to regular foods, sometimes sugary foods, of course, you will have plaque formed on your teeth. So it is very, very important to brush twice a day. So it's not brushing because, I'm busy, usually busy in the mornings. I prefer to brush at night time. It's not your preference. This is something that is very important. We need to brush in the mornings, and then we need to make sure we take off the plaque from our teeth also before we go to bed. I mean, the very last thing before you go to bed. So that is one mistake that I have seen over time. And I mean, it's still prevalent in 2026. Thank you, Temitayo.
Thank you so much, Dr. Blessing, for taking us through that. Finally, take us through other oral health mistakes people still make in 2026 despite their awareness.
Okay, thank you so much. So I would say another mistake that is kind of topping the list would be frequent exposure to sugary foods. Most people believe, how about I cut down on the quantity? I mean, maybe you're the kind of person that snack a lot during the day. You take a lot of chocolate, you take a lot of, candies, you take a lot of sugary foods. Some people believe, how about if I cut on the quantity? This is not about the quantity of what you're exposed to. This is more about the frequency. I mean, as simple as packed juices for children, it's if you check the sugar content, it's usually very high, because for you to get a packed juice, out to the public, it has to be something that the public will be able to take. It has to be something that would sell. So we find a lot of manufacturers adding lots and lots of sugars to their juices, adding lots and lots of sugars to their, ready to made snacks, just so that the public can consume them better, and then of course more profit for them. So sometimes it's not about the quantity of what you're taking, which is also like very important, but then the frequency. I found that a lot of people snack like all through the day. You eat breakfast, after like one hour or 2 hours, you're snacking again.
Take
Some
something
people.
again.
Yes, I mean, you're at work, you're busy. Before you know it, there's chocolate in your mouth, there's candy in your mouth, and then you just expose your teeth constantly to sugars like all through the day. That is very dangerous, and that is one of the like top causes. I know the WHO is fighting that like so well. They're trying to see how we can bring in sugar tax, to countries. I know some countries have started to adopt that already, which is I think it's a policy that will really really work. I think that would actually really help to reduce
Cut down
yeah,
intake.
yes, exactly, cost per intake. So when you know that to purchase some of those unhealthy foods is really high, of course automatically there's an inclination for you to want to cut down on that. But regardless of that, it's our own habit, it is our own choices. Okay, we need to make sure that we make healthy choices. I'm not against snacking, which is it's normal to want to snack, but the best time to actually snack, especially on this
I
sugary
was
food.
going to say that. Are we not supposed to snack again?
Yeah, so the best time you can snack is immediately after you eat. I mean, you just took a bolus of food, you're full, your stomach is like very, very full. It is that time you're supposed to take anything, like any snacks. So, I mean, snacking should be immediately after meal. And after that, let's say you take a cup of water. Before you know it, you'd have kind of rinsed out maybe any food debris present in between your teeth, even some present on your teeth. You rinse that out and then you're good for the day. And one thing also is that once you do that, you're full. Sometimes it is when we eat in like small bits or small chunks, we don't get filled, and then there's always that tendency for us to always want more. But by the time you eat, you're full. You can go 3-4 hours and then you don't need to snack on anything. Okay. So I think it's about our own practice. It's about the kind of choices that we make.
Mm,
But one thing we need to know is that the frequency of
sure.
exposure to sugars is more important than even the quantity of what you're consuming. So we need to make sure that in 2026 is a practice that we emulate. We make sure that we reduce the frequency of sugar.
That we take it off.
Absolutely, if you can take it off completely.
Thank you so much for that, Dr. Blessing. So, if nothing, we have learned from that the frequency of the intake of this thing is what really matters. So, I can't say that I'm taking it in the morning, taking it in the afternoon, taking it at night, taking it the next day, and I want to have a good oral health. So, what would you advise from a dentist point of view? So, what would you advise? Would you advise we cut it down to once a week, twice a week, or what frequency is the best?
All
Really?
right, that's a very tricky question. I would say the frequency of snacking, it actually depends on the kind of snacks that you're taking. If you can consume foods. I mean, you can consume fruits. Fruits have sugars as well. When you're thinking of snacking, take carrots, take cucumbers. You can take grapes, but not too much. I mean, in moderation. The key emphasis here is making sure everything is in moderation. So even if you have to snack, I wouldn't want to say it's once a week or twice a week. It's just
Sure, sure.
dependent. It still depends on you. If I personally want to snack, what I do is I snack mostly during lunch. So once I have my lunch, I usually just have maybe a granola bar, just something to snack on. Once I do
Okay.
that, I rinse my mouth and then I'm gone again for the day. So I would say it actually still depends on your let's say the community or the environment where you find yourself, because of course people still have to eat,
We're
but then it's
looking.
yeah, everything should just kind of be in moderation. Okay, so but the best time is after you have your meal, maybe breakfast, depending on you, lunch or dinner. Just make sure you have that. The key emphasis here is to not expose the teeth constantly to sugars, because most of the cardiogenic bacteria, those are bacteria causing cavities, they feed on these sugars. So you can imagine if the caries causing bacteria in your mouth, they constantly are having something to kind of ingest all through the day. there's almost it's almost it carries cavities for that kind of person is almost like
You
innegotiable.
know,
Like it's because it's something that you've kind of worked this bad organisms, giving them lots of work to do throughout the day. Okay, so I think we need to work on that. One other thing I would want to suggest is for those that love to chew gums, if that's just a way to just keep your jaws, kind of busy during the day, it's best to chew on chewing gums containing xylitol. So xylitol is something that most dentists are promoting these days just because it's like a form of sugar. And then this karyogenic bacteria, sometimes we can say they are dull.
okay.
They think those kind of sugars are the kind of the ones they take. So once they ingest these sugars, it actually kind of eliminates them. So that is why most dentists are promoting chewing xylitol containing chewing gums, sound like gums rather. So that would actually help. You're sending them the wrong signal. So they think it's the kind of sugars, the free sugars that they usually in quotes ingest. So once they ingest xylitol, it's like you're kind of eliminating the amount of sugar causing bacteria, in your mouth, and that can also help. Okay, and I mean that is for those people that love to chew like almost all through the day. Some people have like low saliva production, so they've been advised to chew on gums just to kind of help them with saliva production. So I would say for those kind of people, just kind of
Keep
focus on
saliva
chewing gums.
production going.
Yes, chewing gums containing xylitol, and also for the public, yes, you can chew on that. Just make sure that you don't chew until your jaw starts to hurt. So those are some of the things we can just do, just to help ourselves. Thank you.
Right. Thank you so much for that. That was so profound. And you said something before this last point, or healthy alternatives that really, really struck me. So we don't necessarily have to completely let go of it, but there are other healthy alternatives to snack on, like fruits, like carrots, and all of that. And that was really, really profound. Thank you so much. So before we go to the last two common oral health mistakes. So we can see that major concern for people these days is the cost. So not everyone is able to like afford frequent dental visits or expensive dental products. So Dr. Blessing, how can we as individuals maintain good oral health while still on a low budget, especially in communities in low resource settings?
All right, thank you so much. That's a really very brilliant question. So I would say in low resource settings, the key is still, prevention. Okay, most times, most people present to the clinic, when there's pain or when they have, emergencies. So I would say that we all need to have it like a best practice to still, visit the dentist. In low resource settings, I mean very remote communities, they all need to take advantage of the periods that, NGOs, non-profit organizations come to them, for dental outreaches. That is not the time to get involved in something else because you're getting this thing free. So you would actually realize that it is still the people's choice. I mean, it is the kind of choices they make. So even if you make something free to some persons, it is still their attitude that matters. Okay. So I would say that for those in like highly remote communities, extremely low resource communities, they need to take advantage of the periods where there are like free dental outreaches. Sometimes you can have free medical outreaches. You just go out there and make use of those periods, make use of those sessions. Then I would say another key thing is oral hygiene. Most of the basic oral hygiene practices can prevent cavities, like I would say like 100%. Once you brush
Mhm.
twice a day and then you floss, I would say flossing should actually be daily, because you're like, okay, I maybe a dentist is really far away, and then you know that if you get in trouble you might not be able to see the dentist early. Make sure you floss your teeth every day. If you can't floss every day, floss at least 3 times a week. The reason why we preach or we actually advocate for flossing is because there are some areas in your teeth where your toothbrush cannot penetrate. Most of the contact areas between your teeth, they are so, the contact is so tight that the bristles of your toothbrush will not be able to penetrate. So those are the areas where you need, the floss thread to, just pass through and then take off any debris, any food debris, whatever it is that has lodged there, even plaque that has lodged there. And then, you can imagine doing that every day. Then how do cavities form? How do cavities form? Except if you are the kind of person that has like a genetic predisposition, or maybe there's a, for people that have very low saliva production, when the mouth is constantly dry, then those are the people that that, okay, this one's, you just have to see the dentist, just to help. But in low resource communities, even if it's having a dental visit once a year, and then you're practicing very good basic oral hygiene, you should be fine. Okay, so those are just those are some of the ways we can adjust the rules, in quotes, adjusting the rules for people in low resource communities.
Thank you so much for that, Dr. Blessing. That was really profound. So very quickly, you can take us through the two other mistakes people still make in 2026 regarding their oral health.
I think I touched briefly on the two while I was speaking on the very last points. So I would say it is still thinking dental visits are like optional, or thinking dental visits are mainly for pain or emergencies. So I would say that once you have a dental issue, in quotes, you have dental caries, you have a periodontal disease, you have something, in relation to the mouth, it's usually very expensive. So why not prevent them from happening? So if we can prevent them, because most oral diseases are preventable. That is one thing I keep telling people. They are very, very preventable. So it's more expensive to treat than to prevent. So the key message for the public is to make sure we prioritize our oral health. In as much as you prioritize your general health, when you have a headache, the next thing is you want to take paracetamol, you want to take Tylenol, you want to take something to help, with the pain. So don't wait until you have serious dental issues before you prioritize visiting the dentist. It is very, very important. It is really key to visit the dentist at least twice a year if you have the opportunity, or if you have a dentist within your vicinity. But for those in like very remote communities, take advantage of the periods that NGOs come to visit, okay, and then just make sure you present for a dental checkup, because it is that period you present for a dental checkup that the dentist is able to pick some of there are some cavities that you might not even be able to see. You might not even know something is forming already. So when cavities, sometimes cavities that have not even formed fully, once they are addressed early, it will not lead to it will reduce the progression of the disease, or completely eliminate the progression of the disease. So we need to make sure we prioritize that. And then the other thing is flossing. Flossing is important. Flossing is key. We need to floss. Children need to floss, adults need to floss, the elderly need to floss. We all need to floss at it. Just because of what I stated earlier, that those contact areas, interdental contact areas, where your toothbrush bristles cannot get to, it is only your floss that can get into those areas. And in the market, we have different types of flosses. You can just get the one that works for you. We have the ones that are waxed, because some people feel, okay, no, when I floss, it feels like my gums, it's going to hurt my gums, because the thread sometimes, especially those ones that are not waxed, it can actually have that very funny feeling on the gums. But you just go to the market and get the one that works for you. Go to the mall, go to the store, get the ones that works for you. I personally use the wax flossers because they are a little more gentle on the gums, okay? So we need to make sure you floss. Flossing is as important as brushing, because once you brush, it's like you've been able to get rid of, let's say, 60% of the plaque present on your teeth, because of course the brushing should be able to address the areas close to the gum line. The brushing should be able to address, the areas where you used to chew, and then the back of the teeth. But flossing will help you to get rid of plaque and food debris present in between your teeth.
Thank you so much for that. So flossing and visit to the dental clinic. So before we wrap it up today, you said so much, Dr. Blessing. So I just want us to wrap it up by sharing 3 tips that we can start applying immediately. So you've said a lot of things. So what are 3 tips you can start applying like from right now? The non-negotiables that we should prioritize. So just very quickly, so we can wrap the session up.
Okay, so the non-negotiables, I would say actually everything is non-negotiable, but ranking based on the top 3 is brushing twice a day, flossing daily, if not daily, at least 3 times a week, and regular visit to the dentist. Okay, as much as you can visit your dentist. I'm very, very tempted to add sugars. I'm very, very tempted to add sugars just because you mentioned what are the things you can do like now. It is reducing the frequency of sugary intake or finding alternatives, healthy alternatives during snacking periods. Okay, so those are the things you can start like right now. I mean, you can put that in your 2026 to-do list, and then you're like, okay, this thing I have to start them now. Okay, brushing, flossing, reducing the frequency of sugar intake. I think those are the top 3 that you can start now. But irrespective of those 3, we need to visit the dentist because dental visits are very key. That is, I mean, those are the times that you can actually know if something is wrong, I mean, in your mouth. So it's very, very important to visit the dentist as well. Thank you.
Thank you so much. Thanks. So why I just to digress a bit, why I mentioned those 3 things we can start, because a lot of us hear different things. So this is our audience. A lot of us hear different things. Or do this, do that, without having like action points. So I just needed our own guest, Dr. Blessing, to take us what we can start through now. So if you are watching this now, we've been advised to start brushing twice a day, flossing, and reduction of our intake of sugary things, and switching them for other healthier alternatives. So this does not undermine the effect of visit to the dentist and also other things that Dr. Blessing has mentioned. So any final words to our audience, Dr. Blessing, before we wrap it up?
Right. So final words would be when you have a healthy mouth, you can be guaranteed that you have a healthy body, and most importantly, you have a healthier future. So you know that when you prioritize your oral health, it's like you're prioritizing your general body health, because oral health is like a gateway to the body. So whatever you take in, whatever you do with your teeth, with your mouth, is going to have a ripple effect on your entire systemic health, and this would in turn have a ripple effect on your future. So healthy mouth, healthy body, healthier future. Thank you so much.
Healthy mouth, healthy body, healthier future. Thank you so much, Dr. Blessing, for sharing your time, your knowledge, and your practical insights with us today. This conversation has really highlighted that maintaining good oral health does not really have to be like complicated. It's from everything you said, I've not even seen any complicated thing.
You're welcome. Have a great day.
Thank you to everyone that has watched this far. Please follow us, Oral Health Africa Initiative, for more episodes of Chats with a Professional as we continue to promote healthier smiles across communities. Yes. So until next time, keep smiling and keep taking care of your oral health. Thank you.